Good morning and welcome to the launch of this year's issue of the Nordic Economic Policy Review, which deals with the economic effects of COVID-19 on the economies in the Nordic countries. We are very happy that the Finnish Minister for Health and Family Affairs, Mr. Aki Lindén, will begin this event by some opening words. Please, Mr. Lindén. Yes, in the middle.
Dear participants, ladies and gentlemen, dear friends, I would like to thank the authors of the review and the organizers of this event. It is my pleasure to speak with you today on behalf of the government of Finland. The COVID-19 was and is still a huge health crisis which has had many effects on economics and social life. It has claimed millions of lives globally and placed immense pressure on healthcare and services. While it has been necessary to concentrate on the immediate response, the pandemic has also caused far-reaching indirect consequences on our societies. The human cost from the pandemic is much larger than the direct effects from the disease itself. The report launched today offers a useful analysis on this. Finland has applied a comprehensive hybrid strategy on the management of the crisis. Our goal has been to protect the vulnerable while enabling the functioning of the society and the economy as fully as possible. Trust in authorities and trust in science have been essential, ensuring public approval for necessary restrictive measurements. Health security begins from the communities and local level. In Finland, municipalities carry the responsibility for the prevention of infectious diseases in their areas and for the organizing of health services. Early in the pandemic, the government made a commitment to fully reimburse costs directly linked to the pandemic to local authorities and hospital districts. This has provided important support to the local authorities for implementing necessary response measures. The pandemic has further underlined the importance of the promotion of health and well-being throughout different policy areas. It has demonstrated the importance of the whole of government and whole of society approach. These have proven to be essential during this pandemic, in addition to political leadership and multilateral cooperation. Dear friends, we are more than 2 years into the pandemic that continues to change our world and our lives. We do not yet know how COVID-19 continues to evolve and how our economics and societies will adjust to the profound disruptions caused by the pandemic. Continued vaccination campaigns and the resilience of health system in all countries remain critical going forward. Finland is committed to ensuring global access to COVID-19 vaccines through EU cooperation and international financing mechanisms. Despite severe warnings by several on the risk of pandemics, the world was largely unprepared for a crisis of this magnitude. We should learn the lessons from this crisis so that we can be better prepared, resilient future shocks. There is a commitment by the global health community to ensure that we will improve our readiness. Continuous cooperation is of key importance in this process. Alongside immediate crisis preparedness, we also need to look further ahead. We need to ensure the economic recovery translates into sustainable, inclusive and resilient growth. Policies should aim at reducing inequalities in health and well-being. The Finnish experience is that health protection and health security, when part of a comprehensive strategy, can contribute to and support a sustainable economy. Simultaneously, we need to transition into a net zero carbon economy. Finland's aim is to become the world's first fossil-free welfare state. We want to leverage the opportunities of green and digital transformation. I believe that digitalization can support preparedness and response and enhance the resilience of communities and the society as a whole. Dear friends, Finland is strongly committed to multilateral cooperation in responding to COVID-19 and in strengthening future preparedness. It is critical to learn the lessons from the pandemic. I believe that the Nordic Economic Policy Review is a fine contribution to this discussion. With these words, I would like to congratulate you on the launch of the review and wish you all fruitful events and discussions. Thank you. So I am not telling here my analysis or our minister's analysis of the COVID-19 and its effects, but I'm learning here and listening to the discussion what will be your opinions and your analysis of this. Thank you.
The issue on COVID-19 contains 6 papers. 3 of them will be presented here today, but I will take a few minutes just to say a few words about 2 other papers that we have unfortunately not have had time to squeeze into the 2 hours or so that we have at our disposal. The editors of this issue have been Professor Oskar Nordström Skans from Uppsala University and myself. And the 3 sort of missing papers today is one by Werner Eichhorst and Johannes Brunner, 2 German economists. They focus on labor market outcomes in the Nordics and compare the outcomes with what happened in other countries in Europe. We also have a paper on the learning effects of school closures in the Nordic countries. And we have a paper by Professor Gylfi Zoega from the University of Iceland on Iceland's particular experience. Let me say a few words first about that paper. He makes the salient point that there was a clear disconnect between the chief epidemiologist's decisions on health policies directed at preserving public health on the one hand, and the government's decisions that were directed at minimizing the negative impact on the economy on the other. And Professor Zoega suggests that if both types of decisions had been taken within a unified and consistent framework, such as a cost-benefit analysis, in which increased morbidity and mortality caused by the pandemic is expressed in monetary terms, as in the paper by Lars Hultkrantz and Mikael Svensson in this issue, the social cost of the pandemic would probably have been lower. In particular, Zoega contends that measures to prevent the spread of the virus were unnecessarily costly. Preventive and control measures at Iceland's only international airport would have been less costly than social distancing or school closures, and should have been maintained during the pandemic instead of the stop-and-go pattern that ensued. We also have a paper, as I mentioned, on the effects of school closures by Caroline Hall, Ines Hardoy, and Martin Lundin, researchers at Uppsala University in Sweden. They review research on school closures and distance learning before and during the pandemic. It's a very extensive review, I should mention. The evidence presented in the article suggests that we may expect negative effects of learning from the rapid transition to distance learning, and this appears to be a perception shared by teachers and students alike across the Nordic countries. The challenges of distance learning are multidimensional. There is no social interaction, students being away from school, and some students may lose motivation without teachers and having any real opportunity to counteract the process. The negative effects are also likely to be unevenly distributed across student backgrounds. This makes intuitive sense as parents substitutes for teachers when learning takes place in the home, which may reduce the equalizing role played by schools. The article discusses the evidence supporting this intuitive and concerning conjecture. Although younger students may suffer the most from distance learning, the article notes that the learning loss may be most pronounced for upper secondary students, as they were subjected to the longest closures in all of the Nordic countries. And I hope that Lars Hultkrantz, who will be presenting his article today, will say a few words about the cost of school closures. With these few words about two other articles in the journal, I now invite Professor Torben Andersen from Aarhus University. Torben Andersen has written a paper jointly with Professor Seppo Honkapoja of Aalto University in Helsinki and with Professor Holden of University of Oslo on the macroeconomic effects. Please, Torben.
Yes, thank you very much, and thank you for the opportunity here to present our paper. And as you said, it's joint work with Steiner Holten and Seppo Honkapoja, and this is a paper trying to sort of give an overview of the economic developments and policies pursued during the COVID-19 crisis, and taking sort of a preliminary assessment of these things. So just to have an overview or scoreboard, if you want, this is showing the total number of confirmed deaths due to COVID-19 and the accumulated decline in activity from end of 2019 and until the end of the second quarter of 2021. So not the entire COVID-19 period, but the first intensive period. And you have here a scatter plot of all OECD countries, and you can see the Nordic countries. So we have Norway and Finland in particular standing out as being among the countries have suffered the least in terms of both health consequences and economic consequences. Not that there have not been consequences, but in comparative perspective. Denmark close, but not quite. And then you can see Iceland and Sweden deviating in the two dimensions. Iceland not so much on the health dimension, doing pretty good, but more severe economic consequences. And Sweden, the opposite economic consequences like Finland, Norway and Denmark, but more severe health consequences. So there are some deviations across the Nordic countries, although you could say generally speaking, the Nordic countries are among the countries who have suffered the least during this crisis. So if we look at it from an economic perspective and we think about it as we have had a very severe recession and so on, we will use the usual approach is to think about what is the shock, and is it a shock arising on the demand side or the supply side? Usually there'll be some disequilibrium in the economy, a booming housing market, a financial sector, or whatever. And then we'll look at the consequences of this and the propagation and the persistence and so on. But clearly we here have a very unusual situation in terms of the shock, because it's not arising from economic reasons, but from a health reason. And we have these various containment lockdown measures which were enforced or implemented to reduce contact between people. But of course, contact between people is essential for economic activity, so automatically it would have economic consequences. Of course, when there is a pandemic out there, people would also react, think what can we do, precautionary measures of different types to not be infected, and that would also affect economic activity. So both policies and endogenous behavioral responses trigger an economic effect. And then one can discuss, is this a supply or demand side shock, or what are we talking about? One could think of it as a kind of a market closure or market interruption shock. In particular, the containment and lockdown measures are sort of saying that, well, we put in restrictions on economic activity, and most obvious in the case of full lockdown. And then we have effects on both the demand and the supply side. On the supply side, firms, of course, cannot produce or supply. They would like to do, but they are not allowed. And on the demand side, there are consumers who would like to go to restaurants or whatever, but they cannot do it. So there are clearly both supply and demand effects here. On the demand side, there's also substitution. There's a substitution between sectors. If we cannot travel, perhaps we can do something with our house or something different, or we can substitute over time. If I cannot go on holiday today, I save the money and then I'm ready to go whenever it's possible. So a lot of substitution is also released as part of this shock. And then we have the policies, the economic policies, sometimes called the emergency packages. All countries have done that in various ways. We have a list to the right here of different instruments used, some unconventional measures, but also some more conventional measures which have been used. And I'll not have time to go through these in detail, but really, we see a lot of economic policy activism during this period, which is understandable given the severeness of the situation, but also the need for unconventional measures because it's an unconventional situation we are in. And in a typical crisis, if there's a recession, we'll talk about how can we boost demand, but clearly in the pandemic, that would not make direct or much sense because we want to contain interactions and so on. So therefore, these emergency packages were different. They were motivated in, of course, the lockdown. You can think of a lockdown as an expropriation of market opportunities, but there's of course also distribution insurance arguments for doing this, that we are imposing these restrictions to collectively because we have a pandemic, but some firms or workers are carrying the cost, so we should share the cost. And there could also be efficiency stabilization arguments for doing this. And of course, when we look at the macroeconomic consequences, this is important. And it's sometimes presented as the V logic, that we are in a situation and then we have this shock. We cannot prevent a sharp drop in economic activity because we have these containment and lockdown restrictions. But then it's important to make sure that whenever we can reopen, that the economy easily can get back on track. And therefore, it's important to preserve job matches. It's important to avoid excessive firm closures. We know that these mechanisms, if they are triggered, they can cause strong persistence in the adjustment of the economy. So to the extent that we can prevent that, then it's easier to support this V logic. And you could say this has had a two-handed approach, namely on the one hand, supporting the supply side, compensation to companies, fixed costs, for instance, but also to preserve job matches, wage compensation, or other types of measures there. And then there have also been measures directed at the demand side, protecting the income of people, and also working to reduce uncertainty, which can be an independent negative effect. If people start becoming uncertain about the future, there will be more precautionary also in their consumption and so on. So really many things happening at the same time within a very short span of time, and a significant part of this being these unconventional measures. So dealing with an unanticipated and unusual event, you could say, require unusual measures, and we definitely saw that. And it's just important to remind ourselves that, yes, there are these different arguments. Here put it as the implicit insurance to protect the economy. But these are really very unusual instruments, and that's important when looking forward and when we cannot rule out there will be new waves of the pandemic, that these are very tricky instruments to use, especially if they are maintained for a long period of time. So some of the problems are mentioned here. If we think of it as implicit insurance, what is really the event we want to insure? Can we target this directly to the containment policies? Then there could be an argument, well, these containment policies are out of the control of the firm or the worker, so we should do something. But it's not that clear, because there's also general declines in economic activity for all sorts of reasons, as in any business cycle. So why would we start insuring business cycle fluctuations? We should really be very careful if we make steps in that direction. There's a targeting problem. These measures were implemented in a very short period of time, so it's not a critic. It was necessary to move fast, but it's also implied that the criteria for getting support were very crude, and therefore the targeting in terms of the precision of really reaching those who needed support and not giving support to all sorts of activities of firms or workers who did not need the support is of course an issue, and such measures clearly have a status quo bias, and therefore it's important that they are short-lived and have sunset clauses. I mention all of this because if we are in a new way, we should reconsider the extent to which these measures should be used. In early 2020, we could definitely say this is an unanticipated and very unusual event, but if we have a new way, we cannot keep saying that. So we should be very careful in that respect. If we look at the responses, and I have here at least 3 of them are standard macro charts. In the one on the top left side, you have the GDP, so that's sort of the summary measure, and you can see the development in the Nordic countries and the EU area. This clearly sharp recession. You can also see that for Norway, Finland, Sweden and Denmark, very similar part, more severe recession in Iceland, and then we have the Euro area average, which is also more severe and the level of Iceland. You can also see that this has not exactly a V-shape, but it gets close to a V-shape, a sharp recession and very quick rebound. And then a second wave here, much smaller effect, which is also interesting, suggesting already learning and flexibility in the economy. And then you can see in 2021 in the autumn, Denmark, Sweden, Finland, Norway have higher activity than before the crisis. So the deepest recession on record, but also the quickest rebound on record. So that's pretty unusual, and of course one can say that this V logic is more or less supported by this. There are many things here to discuss. You have many typical business cycle things, responses of private consumption, unemployment and so on. An unusual thing is that house prices were increasing during the period, so it's also pointing to this being very unusual. Down here you have the number of people on one kind or not of these labor market programs as a share of private employment, and you can see that for the 4 large Nordic countries it's about the same magnitude of these programs. The huge, large sectoral differences, we all know that, related to the nature of the shock and so on. It's now quite a lot of papers have shown that when you go into the economic effects here, that they depend on a number of things: the health responses, the capacity in the healthcare sector, the behavioral responses I talked about, the age composition of the population, the economic structure. If you have an economic structure very much exposed to tourism, like Iceland, of course, there's a very direct and severe effect there. The initial economic situation, the level of digitalization, fiscal space, and so on, but also learning over time in coping with such a shock. So, deepest and shortest recession on record. You have here for all the Nordic countries a chart based on OECD projections. The dotted line is the projection before the crisis, and then you can see projections through the corona crisis. The red one is the first, and then the subsequent projections. And the point here is that all projections overestimated how severe the crisis would be, and in particular overestimated how difficult it would be to get a quick rebound. So that has been the positive surprise in this very negative crisis, that the rebound has been very swift. So one can say that the overall policy strategy has worked. It was an improvisation to an unusual situation. One cannot claim it was by grand design, but it has worked. It has been important for that these periods where we have had containment lockdown policies have been very short. These negative effects I mentioned earlier would of course have had more power if we have been in a much longer period. But these are very imprecisely targeted measures, and they have these status quo bias, and we also see a political economy risk that we have now stepped into this area of supporting firms and job matches. And can we then say this was only a one-time thing we did in this pandemic, or would it come up in all sorts of other types of economic crisis? And one of the things we point out in our report is that be very careful with this. This was unusual and it was justified in this particular situation, but these are instruments which used in other situations would have huge cost. Thank you.
Thank you, Torben. We will now move to the next presenter, Professor Lars Hultkrantz of Örebro University in Sweden. Please.
Thank you very much. Well, the pandemic, the COVID-19 pandemic, involved a lot of very difficult political decisions, and decision makers have basically to make trade-offs between the overall economic cost of lockdowns to the macro economy, and also to the cost and sacrifices of specific groups on the one hand, and on the other hand on the effects on health. Together with Mikael Svensson, who is a professor at Göteborg University, I have made a so-called cost of illness analysis of the pandemic in the three countries: Iceland, Norway, and Sweden. And the cost of illness study is kind of a precursor to a cost-benefit analysis. When you do cost-benefit analysis, you evaluate specific policy questions. So, to do that, or to do more, or to do less, and just as when we are evaluating investment proposals, we need to have a look into the ordinary business accounts. We can use the cost of illness to as a basis for doing cost-benefit analysis. Let's see if I can move on. So this was the aim, and we limited our study to the two first waves of the pandemic until August 15. Except from doing the basic cost of illness analysis, we also proceed to in a tentative way do a cost-benefit analysis of one specific policy issue, and that was whether to close down upper secondary schools in Sweden or to keep them open. As you may know, in Sweden, primary schools and lower secondary schools were kept open, unlike, for instance, in Norway. So we do a tentative assessment of that issue ex post. And to come directly to our conclusions, using conventional methods in health economic analysis, the same kind of analysis that is used to evaluate whether new pharmaceutical treatments should be subsidized or not. We come to basically the conclusion that the first two waves cost in health economic terms 1.4% of Swedish GDP, while in Iceland and Norway it was 0.1 or 0.2% of the GDP. And the basic difference between Sweden and Norway and Iceland was that Iceland and Norway didn't experience excessive mortality. Only Sweden did that. So clearly, from the health cost perspective, all countries had substantial cost, and especially Sweden. But as you see, these health costs are still quite small compared to at least the GDP losses during 2020. Our assessment of the health cost is quite conservative. As I will explain, we use what in health economics is called the V value, which is the economic value of the quality adjusted life year lost. Several other economic evaluations that were done during the first year of the pandemic, both in Europe and in the United States, even one for the Nordic countries, used the so-called value of statistical life. And if we had used the value of statistical life, which is normally used for evaluating safety improvements in transportation infrastructure, traffic safety, we would have come to assessments that were at least 10 times as large as we do. But the main difference is that the pandemic mostly hit elderly people in poor conditions. So the loss of quality adjusted life years was quite smaller than the loss of life years during an average traffic accident. Also, we base our estimates on excess deaths and not on total deaths, although we also provide figures for total deaths. A very important caveat is that we have not been able to include post-COVID effects. And even if that doesn't harm so many people, it is a long tail cost where people may suffer during a very long time. So that may be, from an economic point of view, be very important. And as I said, we have this cost-benefit assessment. As I said, upper secondary schools for pupils in age 16 to 19 were closed during the spring 2020, and so students had to continue by remote teaching. And then it happens that the so-called Corona Commission in Sweden commissioned a specific study that investigated the causes of excess mortality at nursing homes for elderly in Sweden. In fact, up to 50% of people dying from COVID in 2020 in Sweden were living at nursing homes for elderly. In Norway, it was even a higher figure. I think it was over 60%. And it turns out that the disease was introduced in these homes not mainly by relatives but by the employees, the working staff. And it also turns out that there was a remarkable difference between this effect from staff that had children in younger ages, that is the ages that were still in school, in primary school and lower secondary school, unlike those that had children in ages 16 to 19. So that gives us a possibility to do a cost-benefit analysis based on assuming that this is a causal effect. And basically what we find is that the benefit from closing down schools would have been 150 million euro. But the possible upper level cost assessment by Karin Hall in this same issue of the journal finds that for these students lifetime earnings may have been reduced by from 0 to 0.6%, and 0.6% is during the whole life is a much higher cost than this health-related cost for the elderly. So, how much time do I have?
You have about 3 minutes.
Okay, yeah. So that was my conclusions. Then I have a lot of slides explaining how I do this. This slide shows that when you compare all the measures done in these 3 countries, it's not so obvious that we really had a natural field experiments that Norwegian and Icelandic restrictions were much tighter than in Sweden. Our cost of illness model estimates the cost of both mortality effects and morbidity effects, and it includes both cold-blooded effects and warm-blooded effects, or the human effects from mortality and sickness, morbidity. And of course, the really tricky issue is this intangible cost, or the human cost. And there are several approaches. As I said, we use the health economic approach, the V value, and just to show numbers, we use a value at row A for all countries about 0.1 or 0.08 million euro per life year, per life year with full health quality. And on C row, you see the cut-off threshold values, the opportunity cost values that is used in Sweden for assessment of new drugs. So our values are quite close to that. I don't have time to talk about column B. Our assumptions, just a very important assumption is that the quality adjusted life years lost per death in our model is assumed to be a little more than 3 years. And the basic reason is that most of the people dying from COVID died on elderly care homes, and they don't stay there for a very long time before they die. Thank you very much.
Thank you very much, Professor Hultkrantz. We will now move to the third paper by Professor Kristina Huttunen, Aalto University, written together with Hanna Pesula. Please.
Okay, thank you. And so the topic of my talk today is on the COVID-19 crisis and the labor market outcomes by gender in Finland. This is joint work with Hanna Pesula. So the COVID-19 crisis, or the pandemic, had clear labor market consequences. And there are several papers that have actually documented these short-term consequences from other countries. But there's several different reasons why the COVID-19 crisis or the resulting recession could be different from previous recessions. First of all, the service sector was mainly hit, while in general in recessions, what we see is that that manufacturing sector is the more affected. So the crisis that we have in hand or had in hand is different. And another important difference to many different previous economic crises is that we have a crisis that was affecting not only workers but everyone in the society. And we had many restrictions in place that were affecting also children. And these childcare and educational responsibilities were also affecting parents because they couldn't no longer take children to the daycare centers. And this could in itself have an impact on the labor market situation of the parents. And for these two reasons, the COVID-19 crisis, if it had any labor market consequences, we could suspect that it might have different impacts on males and females. And there's some evidence from other countries indicating that the short-term responses were more severe for women. So what do we ask in this study? We asked 3 questions. First, how did employment of men and women evolve in Finland during the pandemic? And we used to explore this question, we used this very high frequency data where we have all the payments or payrolls at daily level. And in addition, we are going to use the labor force survey from other Nordic countries for the Nordic comparisons. And we're not only going to document the incidence of job losses or earning losses during this period, but we also asked the question, what happened to the individuals that lost their jobs during the pandemic? Like if there were people who were furloughed or became unemployed during these months, did their employment and earnings bounce back very rapidly, or did they have a longer time consequences? And finally, we asked, did these earnings and employment consequences differ by gender and industry and family status? So first I'm going to just show with the labor force survey from different countries, the employment rates and just the aggregate employment responses by men and women in different Nordic countries. And we do see from this picture that there was a drop in the employment rate in the second quarter of 2020, which is the time when most of the countries had all these restrictions in place. It was a bigger drop for women, and there's big differences between countries, which were discussed already in the previous talks, but we see the biggest drop, especially in Iceland, in the employment in percentage points. But in all the countries, there was a drop in employment level. It's not very, the differences between male and female employment rates, or the change in the employment rates, is not that clear. In Finland, actually, we do see, according to this aggregate data, we see a bigger difference in employment changes. But both men and women, the employment rates decreased. So let me go directly to the analysis, or zoom into Finland now. First of all, Finland, in this picture, I'm just going to show the black line is showing the number of COVID cases in Finland. And then I will talk briefly about the restrictions that took place. Finland, the COVID cases started to rise in Finland at the same time as in other countries in March 2020. And Finland reacted quite fast. The schools closed down already at the end of March. Restaurants closed in April. There was a restriction on traveling from Helsinki region, the Uusimaa region. But most of these restrictions were very short-lived. So by the end of May already, 2020, the schools reopened, the restaurants opened in June, and the gatherings of people were kind of relaxed. Later in that year, the number of COVID cases started to rise again. But then there were no longer nationwide restrictions. Then there were restrictions, but they were local authorities were making these restrictions. So with this figure, I'm just showing now, doing this, the x-axis is the calendar months, y-axis is the employment in thousands. I'm just showing what happened to employment of women and men during this time in Finland. The red line is the 2020. Black line is the pre-COVID year 2019, and the blue line is 2021. We do see that during the months when the restrictions took place, the employment of both men and women dropped. There was big differences by the industries. The drop in employment was especially big in the sectors such as hotel and restaurant services. With this picture, I'm showing how this change in the drop in aggregate labor earnings in different sectors and the share of women in these sectors is related. And we see that some of the very female-dominated sectors, such as hotel and restaurants, were hit very hard. There was a big drop in total earnings, that is employment in these sectors. And while however, there are some female-dominated sectors, such as healthcare and social work, that were not hit at all, of course. Some sectors, such as logistics, is very male-dominated sector, and there we also saw a big drop. I want to highlight also that the size of these balls in this picture is illustrating the size of the sectors, and we see that the hotel and restaurants, even though they were hit hard, they're still very small sectors, so we are not overall the impact wasn't that big. The next step in the study was to focus on the individuals that became unemployed or were furloughed during this time period. So we focus on job losses that occurred between March 2020 and February 2021. And what we do in this part is that we follow individuals in these registers 6 months before and after their job loss in order to illustrate what happened to these individuals that were laid off during this time period. Let me just say that job loss here means that you are registered as unemployed or you are furloughed during this time, and most of these individuals actually during this time period were furloughed. What we do see here is that if we are comparing those men and women that lost their jobs, their earnings drop at the time of job loss, and it remains at lower level. And with this picture, I'm gonna maybe illustrate it even better, because now instead of just showing the raw earnings of this group, I'm just showing the difference to the how did the earnings drop compared to the baseline and compared to how the earnings evaluated in the comparison group. So this picture shows that when the individuals during the pandemic, when they lost their jobs, their earnings dropped significantly, both for men and women. We need to remember, of course, that men are earning more, so the percentage drop is very similar to both groups, even though the absolute drop is bigger for men. But what is really interesting is that the baseline is now the zero, which is basically the pre-earnings pattern that these workers have. After 6 months follow-up period, these people have not yet catch up. So it doesn't seem to be that it's kind of just a very quick jump and jumping back. On average, the earning loss of these individuals or the earnings remain at lower level. Let me highlight that the earnings is now monthly earnings, and if you're not earning anything, you're there as a zero earner. So this is a joint employment and earning loss, and mainly reflecting the employment loss. I motivated this talk by the fact that it might be that the care responsibilities between men and women for parents might also affect the costs of employment cost of pandemic. We don't really see big differences between women with children and women without children, and with men with children and with men without children. But we wanted to check this because if the school closures and closures of the daycare facilities affected the job search behavior of these individuals, we could have seen maybe more pronounced impacts for parents than for others, but we don't see it according to this result. So let me just conclude what we did in this study. We documented that in Finland we did see a drop in employment levels during the pandemic. The sectors that were hit especially hard were service sectors and hotels and restaurants, but also some sectors such as logistics were really hit hard. We don't see huge gender differences in average on like the cost of job loss during this time, and family status doesn't appear to be related to these costs. What is interesting is that during this follow-up period of these individuals that lost their jobs or were furloughed or became unemployed, we don't see that their earnings recovered during this time period.
Thank you, Christina. We have a few minutes for questions, if there are any from the audience here. No questions. In that case, I invite the panelists. We have panelists here that will discuss the findings of the papers and other issues as well. And Oscar, my co-editor, will lead the panel debate. Oscar.
Okay, so there was a bit of a technical switch there. So now we introduced the panel, so we're very happy to have three distinguished panelists here who are all being equipped with microphones. So first to be done is Professor Seppo Honkapoja from Aalto University, so please take one of the stands And then second up is Kristiina Huttunen, who is a substitute panelist with absolutely zero time to prepare for this. So we're really happy that you are also here. And our third panelist is Joachim Sonnegård, who was the main secretary of the Swedish Corona Commission, which was a very long, or in this context, long and extremely serious assessment of everything that had to do with the Swedish response to the COVID pandemic, both health-related and economic things. So we're really happy that you can join us here. So this was now we saw an extract of some of the interesting papers that we had in this special issue. So I think it's kind of natural to start by asking you what sort of your main takeaways from this report was. I don't know if you want to start, Seppo.
Okay, so yeah, I mean there are obviously many things, but what I find, perhaps, and I'm a macroeconomist, so I don't look at the sectoral stuff or micro stuff so much. But from what I find is, obviously, the pandemic was a big event and created a big recession. Some of the aggregate numbers are really big, but it was very short-lived, and that I think is the one of the surprising things, and which is basically, we had huge recession, very quick recovery in many countries, and that is unusual, because usually if you look at economic cycles and economic crisis, the recovery from the crisis is not that fast. So I think we know some reason why this is a different case now, but I think it is it's the nature of the shock. If I look at often the big crisis is a financial crisis, for example, which starts in the financial system of the economy, and then, for example, but then this one came from the outside, a total surprise, because this was almost 100 years since the previous global pandemic was here, and then so that's the setting, and I think the fact that it came on the outside was quite important here. That the mechanism was the first mechanisms were really these lockdowns and so forth, and then people also adjusting themselves behavior, wanted to reduce the contacts between other people and so forth. So that is unusual, and that may have some of these things may have contributed to the.
So essentially, that there was no sort of structural deficiency
exactly, no,
within the countries.
Yes, and also I must say that the policies were designed, at least to some extent, in this kind of way that not add aggregate demand to the story, but then try to maintain production capacities, try to reduce the possible bankruptcies of firms, and also incomes of the people. Better labor. If there was furloughs or similar, then there would be usually the combination levels were increased somewhat. So I think that the policy measures, even though they were done in great haste, in early 2020, were not the outcome was not bad from that point of view. They were of the right type, and I think this has helped in making this big recession shorter. Of course, added to that is really that the second and third wave of the pandemic, in terms of the number of incidences of sicknesses and so forth, created basically no recession. Mm-hmm. So this is an unusual period, I think, and there'll be certainly further studies on this. Why is it the case? Big recession, that I can understand. That's a surprise. But then people, in some sense, the economists learn very quickly, so that the second and third wave didn't create any recession. That I think is the surprising thing, and we're starting to learn that, but more should be done on that.
I think a lot of us were actually surprised by
Yeah.
the resilience of the economy, which is a great thing. So that was the macroeconomic perspective. What do you say, Christina? I think of you as more of a micro person.
I think that as a micro person, especially a labor economist who is also thinking about children, I think one of the important takeaways is that we don't know yet all the long-term consequences of this. I do think that this is a very it does seem to be short-lived, as Seppo said, but still, especially when it comes to the school closures, we don't yet know the consequences on the children. Also, when we go to the individual level and look at the individuals that lost their jobs, we know from the previous literature that this, losing a job and career interruptions might have a long-lasting consequences. So this is also something that we would like to see in the later. What are the true costs and consequences of the crisis? But it's true that
is it also possible that the people who lost their job in this recession may actually fare better than some of the people who lost their jobs in other recessions, precisely because there is this lack of structural imbalances that are
I
driving
think absolutely, because we know from the previous literature on job losses that the deeper the recession, the worse it is for the individual workers to catch up, and they earn. So this is again something that I would like to see done and see how it works. But I'm suspecting that because of this short-lived recession, it doesn't seem to be might not be as severe for the workers that lost their jobs.
So Joachim, with your now spending years looking at these things maybe more thoroughly than anyone else, what's your thought on this? And what did you did you find anything new in these reports that you didn't know already from your extensive work?
One thing I noticed is something which I think is absolutely crucial when you're dealing with a disease like this, a pandemic disease, and that is that speed is of essence when it comes to take measures in order to both handle the economic consequences of the crisis and to handle the health side of the crisis. And you could see it on Torben's first picture, where you saw Finland, Denmark and Norway in the close to origo when it comes to loss of activity and loss of human life, and Sweden, which was very swift when it came to economic measures, but not as swift when it comes to health measures. We lost many more lives, but we handled the economy in the same way as the rest of the Nordic countries did. And that actually has to do with this. We are dealing with a phenomenon with exponential growth. When you see a few cases of COVID, then you don't have some society to spread yet. But if you wait for more information to base your measures on, then you have spread in society, and then you can't actually contain the disease. And that will hit both the economy and health and increased mortality. So you have a window of opportunity in the beginning of an epidemic like this to take measures, and that those measures will actually have an impact on the whole development of the disease, the epidemic. And that's a very important key issue that I think policymakers will take to the heart for the future.
So when you all mentioned the policy responses here, which obviously is an interesting topic, but how should we think about how to organize the decision making in terms of the economic responses?
Yeah.
Should that be integrated into the health responses?
In the case of Sweden, it was quite muddy, I would say. It wasn't hazy. It wasn't clear what the policymakers, the decision makers actually had on their table when they were making decisions. The health authority, Folkhälsoinstitutet, are obliged to take into consideration all health aspects of their measures, which includes, I presume, but we couldn't actually get that clear, that they must take into account the health aspects of unemployment when they are. And we didn't see any calculations or loss of school years, further earnings and stuff like that. And the government said quite early on that this is a health crisis primarily. It's not an economic crisis. primarily, and the connections between them, they didn't want to touch that topic. It was too sensitive. That's my interpretation, at least. So if we could have decision makers that actually put on the table the real situation where you have a trade-off between life and economic activity.
So in that trade-off, would we see a place for the quality-adjusted life years? Would any politician deal with that? Or?
Yeah, but what they deal with that every time that they make a decision on infrastructural investment. So
yeah, I guess, and medical, but that's less salient, I guess.
Yeah, I know. So that's a window shopping problem, I would say. That it becomes visible, and I understand that people find it offending that you are talking about the marginal value of elderly people's death compared to the rest of the population, but that's a matter of fact that the decision makers, like generals in war, have to take that kind of decisions. So I think they should have been more transparent with that and integrated it more structural, in a more structural, well-organized way than they did in Sweden, at least.
So what do you say about the policy thing? I mean, I think about at one point when I was arguing that probably we should combine all these decisions in a uniform process. Some macroeconomists told me, yeah, but think about monetary policy and fiscal policy. There we really want to separate it, and it's enough that you know what the other agent is doing. So do we need to make these decisions jointly, or can we separate them and just have clear enough roles so that it works anyway?
Well, I think this is a question which has to be considered in the future. Of course, when the pandemic hit, there was no time to think about the interactions, and it was primary to get the both of the economic and social aspects, and also the health aspects going fast, as been a number of people have said here also today, and so it's a challenging question to ask. Say, how should we take into account, and how good is our knowledge between the health relations and the economic relations? I know that there are now a few people have done, and there are research programs going on looking at incorporating together the epidemiological models and for example, in the macroeconomic models, but that this kind of research takes time because and so we don't quite know yet, but I think it's an important, interesting research area to see what are the interactions between epidemic and the macroeconomic fluctuations. It is a natural one, and there are some first papers which are at least in a sort of working paper stage now which have been doing that. So yes, I think in principle yes, but there's a lot we need to know, because if we don't get the relationship right, but we say that there is a relationship which is not very well based on a lot of research, then things may go badly wrong as well. So I would caution at the moment, but would say that this is a very important topic which needs further work.
So thinking about knowledge production, so you mentioned briefly, Christina, during your talk that you were using these high-frequency data, which has been used also in other Nordic countries. It's sort of one of our pride and nice infrastructures in the Nordic countries that we actually produce a lot of data from our different administrative systems that can be used for research. But do you think there is potential for using these even more? I know it was done to some extent in Finland, maybe more than in other countries, used also in real time. But as far as I understand, that was also an ad hoc construct to the crisis. But do you see sort of a potential for the Nordic countries to use this kind of high-frequency data to have better monitoring of other types of crises as they evolve, so that we can make better adjustments early on in crisis?
I think it's absolutely really important to be able to do it, and I don't see any reason why we shouldn't be able to do it, because we have the data and we are collecting all this information. And as we have been talking about, the crisis at the moment is very different from, or the COVID situation is different from many other economic crises. So we could have like real life data at that time, kind of understanding and evaluating what is happening. I also like to, can I say something about the previous point that you were talking about, that these two decisions? I do think that it's true that it was really, the time was very, it was hard to, we needed to make decisions fast, so it was hard to integrate these, and we still don't have a lot of knowledge on combining this. But we also know, also have knowledge that we know that when in the economic downturns and job losses, for example, are related to worse health consequences, and we could actually put a number on, like calculate how many lives are lost with every job loss. This is from the previous literature from many different countries. We kind of have found that there's an increased cost of health cost of losing your job exogenously. So I think that this type of information was not, at least in the public and in the policy discussion, used at all. And I think that this could be maybe in the next step we could think about more how to integrate this information, or the knowledge that economists and other social scientists have already, or the epidemiologists have about the relationship between the labor market situation and health.
Yeah, we would like to complement this, because within the health sector and people who are dealing with health questions, it's a well-known fact that socially economic weak individuals always suffer worse when it comes to illness and disease. And these groups are also overrepresented in service sectors jobs, in contact professions. And in this case that those people are more economically pressed to go to work and have not the same opportunity to work on distance with a computer like we have. So they could predict that those groups actually will be hit hard, and they were. They were hit from the disease. The mortality among those groups in Sweden, at least, were much higher than the average, and many times higher than compared to the group in this room. And they also were most badly hit economically by job losses and loss of income. And that was known before that this will happen, but the measures weren't designed in order to handle that issue. So.
It's true also that you mentioned to me earlier that some of the economic policies are actually also health policies in terms of changing the rules for compensation when you're staying at home, when you're sick, so that people with poor means are not pushed into going to work while they experience some symptoms or things like this. So that's also something. So one of the things that was mentioned here was the policy response again, and I guess what both Christina and Joachim, what you're saying is that these kind of really unusual measures that most governments used, I believe all in the Nordic countries, that where you're really aiming at preserving jobs rather than ensuring workers, partly, I guess, motivated by the feeling that it's not underlying structural change that drives the cycle. That one of the points of this, of course, may have been that people were not laid off, and that may have prevented some of the bad consequences of job loss in terms of loss of life and other things. But so what should we take away from that for the future? I mean, was it a one-off thing that we use these policies? Or will we see them more in the future? Will the fact that we had this, as Torben talked about, these compensation, people were somehow unfairly hit by the shock, so they should be compensated. Is this in part perhaps driving now demands for everyone should be compensated for higher electricity prices, gasoline prices? So did it put sort of a prejudice or a sort of a reference point where we now will see demand for compensation schemes for all sorts of shocks? So one of your background, Joachim, is as also the main secretary of the Fiscal Policy Council. So you know well how how to think about fiscal frameworks and these kind of things. So how do you think about these policies in that perspective?
Yeah, they have actually. It was quite bold and daring, I would say, from the Swedish political system to abandon the doctrine which has guided budget policies in Sweden for the last 20 years. The parliament made available 300 million Swedish crowns during 2020 just in order to handle the pandemic and its consequences, and only half of that amount was actually used. So the government really did stretch here. And we can already see that some parties now are arguing and have as a platform for the upcoming election that this deduction for first aid deduction on your sick insurances should be abandoned. And that was a very good measure to take in the beginning of the pandemic, just in order to keep people at home, so you could contain the spread of the disease. But you're losing if you don't abolish it. You're losing the insurance dimension of the schemes. So you will actually run into the same kind of problems that you were trying to handle by introducing the deduction. And I think it's quite geographical, this problem. If you have a parliament like the Swedish one with a number of parties, which none of them can actually form a government, it's easier to haggle over different kind of measures and supports and benefits than it is when you have less parties and a more stable majority. So I think if we have a government after the upcoming election which has a stable support, then I think that problem will be handled. I saw the finance minister had a op-ed yesterday, or was it today, about the importance of preserving the budget doctrine that has guided budget policies for Sweden the last 20 years. So there are insights and feeling of how important these kind of issues are in order to be able to have a buffer like the one we had in Sweden when the pandemic hit the economy. Without that buffer, we couldn't spend as much as we did actually. So
what do you say, Seppo? Is it have we sort of as unintended side effects of this thing now? Maybe even abandoned the principle of supporting workers, not jobs.
I don't think we have abandoned that, but clearly there are some groups that they have seen that there are these very unusual compensations being done, and then they are asking for these sort of things again more. But I think we should be pretty clear. I think on this that what was a measure in a pandemic, which was a big and very sudden measure versus something else. Then these compensation things are different too. To give you one example, which is very controversial, is, for example, is the higher energy prices and fuel prices. That now in a number of countries now, some countries in Central Europe have already, and also Southern Europe have already introduced some systems changing the taxation reform or other measures. Whereas other countries have not yet done, but this is going to be a big debate, and I'm looking forward to see what the Finnish government eventually will do. So far, economists have been very orthodox, saying that this should not be compensated, and saying that especially compensating by lowering the tax on gasoline and so forth is highly costly and not very effective. You don't target the right sort of people on that. Then these things are going to be are on the table now for different reasons, but not the pandemic any longer, but the Ukraine war and related things. And I think it's important to say that Ukraine, this kind of war thing is different from the pandemic. The pandemic on the whole was relatively fast. I mean, we see the later waves. We saw that the economic effects were relatively small in the later waves. And so there you could say one-time exceptional measures are fine. But if you continue years with these, then you get into a big muddle. I think that's at least my personal view. So one has to come to the more orthodox situation, and the ways of compensating, for example, for the high gas prices is not to lower the tax rates, but rather look at the people who are suffering most for that and try to compensate them in some way or other. But I think the same idea that just compensating by taxes which were existing, which were done in the pandemic, should not be used in these more long-lasting, difficult questions like the higher energy prices.
Mm. So, Christina, what do you say? Do you think these unorthodox labor policies that were put in place during the pandemic, which I think the general sentiment is that probably they worked. That's the gist, I guess, of the papers. They were probably costly, but working under these very specific circumstances, do you think it will mean a change in the policy mix of what people will use in other recessions?
I don't think it necessarily means that we are changing the policy mix in the other recessions. I think that, or in general, I think we always need to keep in mind that every situation is different. We know that also the policies might work very differently depending on the, also the worker policies. Let's take just any unemployment benefits durations for workers as well. It might be have a bit different impact on during the deep recessions or during the better times. So I think that now thinking about what we did during this pandemic or the compensation for firms, I think that this is something that we don't need to take as something that we use in the future. We need to think about it like kind of learn from this period and think about the next steps in the next periods.
So now, since this is the Nordic Economic Policy Review, so I think it's useful to think about, what can we learn from each other across the Nordic countries. I think one of the great things about the Nordic countries is that we've always been good at learning from each other, in the sense that it's useful because countries are similar enough so that we usually can think that evidence from the other Nordic countries is somehow applicable to our own economy, but still we're doing different things. So that allows us to learn from each other. So my sense is that during the pandemic, maybe there was not that much interest in learning across the borders in terms of the health measures. I got the impression from that most countries were very much looking within in terms of trying to figure out what to do. But maybe not so much in terms of the economic policies, where policies seem to have been sort of relatively similar. But you've also been a researcher in Sweden, so you've also been around and learned from Nordic countries, and we certainly learned from your visit. So, but so what are your thoughts on Nordic countries learning from each other in terms of economic policies?
I think as a labor economist who normally uses observational data, and I normally kind of wait before I get the data and the policies are passed and then start evaluating it. I think that we will learn a lot from, it's kind of a nice thing about this situation is that we didn't have exactly similar type of reactions in different countries. So I do think that we will learn, more. But what did we learn at this stage? I think that there was probably, it's easier to see in the future once we start analyzing this period. This is labor economist perspective and not policymakers' perspective.
No, that's fine.
Let me say one warning which I think we have in our report, which is and also in the paper, is that this crisis was very sudden, and the reaction also was very sudden, and a whole batch of policy measures. They were partly motivated by the health concern, but then also on the economic side were set up. So it's going to be difficult to analyze what was the one single efficient measure for the or a few. That assessment is going to be very hard because the whole thing is bunched together, and so that, and I think I've been reading some of the macro literature further, and I think people are realizing that one thing which is coming here is that if you have a big crisis like the pandemic, then it is important to respond strongly and not delay. The pandemic was very obvious because the epidemic was spreading, but even other crises, which can be financial crisis, for example, again requires a quick response. So I think what is important is that you have the sort of principles. What the sort of reaction would be. Of course, the final details will have to be decided at when the crisis hit. But have a little bit of a overall design or framework how to think about it and how to we now have pandemic, which is a different macroeconomic shock to the economy than the financial crisis, for example. And so I think it's important for the macroeconomics toolkit also to keep these differences in it, and the policy measures are going to be are quite different. There are some same measures, but there are also differences, and I think that is important to keep in mind in the future, because it looks like we since 2008 we had the financial crisis, then we had in some European countries we had the public sector crisis. Public sector debt crisis, and then came the pandemic, and now we have a war, which is creating new problems again. So we seem to be living through a series of crises here.
It seems to be a never-ending sequence of new types of crises. That's true.
Can I add something there? I think economic policymakers learned very important lessons during the 2008 and 2009 financial crisis. First is that speed is of essence, and the second is that you can't exit too soon. You have to let it be in place longer than you actually want to. And I think all economic policy makers had learned that lesson and used it during this crisis, which was very important. And I know that the finance minister and civil servants as the Minister of Finance and the central bank, they were discussing with counterparts around the world on a daily basis almost in the beginning. But what kind of learning was going on there is very hard to disentangle, so to speak. We also know in Sweden that the epidemiologists at the health agencies had almost daily conferences with the Nordic colleagues, European colleagues, but the Swedish one didn't learn from their counterparts. That's for sure.
So we talked a lot about all the stuff that we know, but I guess as scientists, we're obsessed with the things that we don't know. So if we sort of end the discussion by thinking about what are the most sort of interesting or important things that we need to figure out going forward from what's sort of the main topic on your minds in terms of the economic effects of the COVID-19 that we need to know more about going forward, starting with you, Christina.
Again, as my background as labor economist and somebody studying human capital, I always think about the kids as well and the longer-term consequences on this learning gap. I think that's something that we just cannot, it's going to take time before we know the true consequences, but I think it's really, really important also for the next crisis, because then we really know that these are costly measures, while I think that often the policymakers at this, during the first period where this was not first brought up, the consequences for the kids when we started closing down the schools. So I think that's one of the things that I have in my mind as well.
So what do you say, Seppo?
Yeah, I mean, I certainly agree on much what Christina said. It's important to have an idea what the costs are, especially, for example, labor market measures and these school closures, I think, and there will be valuable information now coming from the studies about it. So, and that has to be in the knowledge for the future when the next pandemic hit or crisis hits. Here I think we will. I think there's good scope and possibilities to improve the situation, to improve the understanding. The other ones, as I said, are quite a bit harder. Let me just take one example, which is that one novelty in the macroeconomics arena, which happened during the COVID crisis, was that something was called the macro-prudential policies were used in a big scale. But I think they were not even noticed much in the press. The capital buffers that are required from banks and so forth, they were reduced drastically. And that's something which I think people learned from the 2008 financial crisis, that the part of the crisis there was that there were the buffers were insufficient. And then there was a build-up of that, and the macroprudential policy framework was more or less created after that, in the last 10 years or so. And now they were used for the first time, but I don't know what the effects are, because it's just one part of a big policy package.
Maybe some of them are also a bit difficult to scale back, given the situation.
Indeed, but I'm sure I would expect that. I'm no longer in a policy maker, but I would expect that the macro-prudential policies will start to go back to normal, but it'll take time.
So what do you say, Joachim?
Yeah, I think that the most important thing to learn from this crisis for policymakers, and actually that is something which researchers will benefit from, is that the need for real-time data in order to get a sense of what's going on and to make an informed decision. And there are a lot of data in the Nordic societies which are there, but they are kind of tricky from administrative reasons to get hold on in real time. And that's one thing. The second thing is that you should actually prepare and have different administrative systems in place in your drawer, so to speak, which you can implement immediately. Now you had to improvise too much in this crisis. I talked with some civil servants at the Ministry of Finance, and they had a crisis preparedness exercise in 2019, and they prepared for a real estate crash. So
Everything crashed.
Yeah, exactly. But you have to have administrative systems out in society in order to handle these kind of support systems, both to firms and to individuals, and to know that they will function directly and not with all these mishaps which we have to suffer from.
Excellent. So I think we're dead on time. Thank you so much for a very insightful discussion, and for, in particular to Christina, for doing this really without preparation. So that was excellent. Thank you, and thank you for everyone who's been listening here.